July the 2nd, 1944, underground hospital cave near Cherbourg, France. Dr. Schwester emerged from darkness, hands raised in surrender. She hadn't seen daylight in days. The Americans cannot possibly have the medical supplies they claim. This must be propaganda to break our morale. These words, spoken hours earlier, would soon shatter. Behind her, 8 other German army nurses followed into the sunlight, among the first captured by American forces. They had spent days treating wounded soldiers by candlelight, rationing morphine, boiling bandages for reuse. None knew that within hours they would witness medical capabilities contradicting everything they were taught. A medical system so advanced, so abundantly supplied, it would shatter their understanding and ideological foundation. Colonel Richard P. Johnson, commanding officer of the 45th Evacuation Hospital, studied them with curiosity. Enemy medical personnel, yet fellow healers. Within days, these nurses would be returned under Geneva Convention protocols. A total of 16 German nurses would be exchanged on July 2nd and July 9th. But first, they would witness American medicine. Medications they had only heard rumors about, surgical techniques beyond their training. The psychological impact would last. The unraveling had begun over a year earlier, on May 13, 1943, in the scorching heat of Tunisia. General Hans-Jürgen Phonim's surrender included combat troops and thousands of medical personnel, doctors, orderlies, and Dr. Schwestern, German Red Cross nurses who had served with Rommel's Afrika Korps through 2 years of desert warfare. Among the captured was Dr. Schwester Ilse Schultz, who received the Iron Cross Second Class in April 1943, one of fewer than 20 women ever to receive this decoration during the war. Her colleague, Dr. Schwester Greta Falk, also decorated, kept careful observations. Observations later discovered in German military archives. The Americans throw away more medical supplies in a day than we received in a month. They have medicines we have only heard about. The scale of the surrender was staggering. 250,000 to 275,000 Axis troops, including medical staff. From elite divisions like the 21st Panzer, 15th Panzer Division, and the 90th Light Division. While most captured medical personnel were male, the nurses experienced a profound ideological shock. American processing followed strict Geneva Convention protocols with remarkable efficiency. At collection points, American medical officers sorted personnel within hours. Those needed for German wounded were retained. Others were marked for evacuation. Every captured nurse received a medical examination using scarce equipment. By June 1943, the first groups of captured German medical personnel boarded Liberty ships for transport to the United States. These mass-produced vessels contradicted German propaganda about American industrial weakness. The ship's medical facilities exceeded anything German nurses had seen in their homeland. Operating theaters with consistent electric lighting, functional X-ray machines, and refrigerated medicine storage were standard. Most striking were the blood plasma supplies, properly typed and stored units that could be administered safely. Unlike the risky direct transfusions German forces attempted in field conditions. The ocean crossing revealed American medical abundance daily. Sulfur powder, rationed by the grain, was used liberally. Bandages were disposed after single use. German medical personnel watched American medics discard uneaten food portions. Waste that would have been unthinkable in the Wehrmacht. Ships carrying German medical personnel docked at ports. Their first glimpse of America contradicted years of propaganda about a nation supposedly weakened by economic depression. At Norfolk Naval Base, medical processing included comprehensive examinations for all captured personnel. Dental work was performed, infections were treated, and those needing corrective lenses received them. This level of care exceeded what was available to German civilians. The rail journey inland provided continuous revelations. City after city displayed illuminated hospitals. In Richmond, the Medical College of Virginia complex was visible from the trains. In Philadelphia, Pennsylvania Hospital's imposing structure could be seen. Every urban center possessed medical facilities surpassing those in major German cities. At a Washington, D.C. stop, American Red Cross volunteers boarded to distribute packages to German PWS, toiletries, cigarettes, chocolate, writing materials. German nurses indoctrinated in racial struggle ideology struggled to comprehend this kindness toward enemies. Camp Opelika, Alabama opened in September 1942 and received its first Africa Corps medical personnel in June 1943. The camp hospital became a unique environment where German medical staff trained in Nazi racial medicine worked alongside Americans practicing clinical medicine. The dual staff system followed Geneva Convention requirements. American medical officers supervised while German personnel provided direct patient care. This created an unprecedented situation. Enemy medical staff operating within the American military medical system. The facilities astounded German nurses. Operating rooms contained equipment they knew only from textbooks: electric cauterization, adjustable surgical lights, rapid sterilization autoclaves. The pharmacy held hundreds of medications in climate-controlled storage, with expiration dates years away. On July 21, 1944, Glennon General Hospital in Okmulgee, Oklahoma, became German prisoner of war General Hospital No. 1, with 1,690 beds, staffed by parallel American and German medical teams. Colonel Henry W. Misch implemented something unthinkable in Nazi Germany: integrated medical teams sharing knowledge across enemy lines. German nurses from the NSA shaft, who had been taught American medicine was weak and corrupted, discovered a system based on rigorous scientific method. Most challenging to their worldview were the African-American nurses assigned to P wards, a result of U.S. military segregation that relegated black nurses to treating enemy prisoners rather than white American soldiers. German nurses observed these professionals providing skilled care that contradicted every racial assumption they had been taught. Nothing demonstrated American medical superiority more dramatically than penicillin. In 1943, the United States produced 21 billion units. By 1945, production reached 6.8 trillion units. German medical personnel operating without effective antibiotics witnessed routine use of this miracle drug. At Camp Forest in Tennessee, which housed German PSWs and included extensive medical facilities, German nurses observed transformations they considered impossible. Infections that meant certain death in German field hospitals cleared within days. Where German surgeons would have amputated, American doctors saved limbs. American medical officers, many civilian doctors in uniform, shared knowledge freely. This openness toward enemies contradicted everything German medical personnel had been taught about warfare and medicine. The American blood plasma system represented another leap beyond German capabilities. Proper typing, cross-matching, and preservation prevented the often fatal reactions from direct transfusions still used by German forces. At facilities like the 21st General Hospital at Ravenol, France, where captured German staff worked from December 1944, the blood supply system operated with industrial efficiency. Plasma stored for months, transported thousands of miles, administered without knowing blood types. Capabilities that German medicine hadn't achieved. German nurses trained in the N-Swesten shaft had learned that medicine served racial improvement. Their education included Herbann-Race and heredity and racial studies, teaching that weak patients should be eliminated to strengthen the race. At facilities like the 12th Field Hospital's 30,000-bed P operation, they witnessed the opposite. American medical staff treated German prisoners identically to American wounded. Enemies received the same scarce medications, surgical procedures, and nursing care as Allied soldiers. This fundamental difference, medicine as universal healing versus racial tool, began demolishing their ideological framework. Christmas 1943 delivered profound psychological impact. American organizations sent 500,000 packages to German PSWs. Each contained wartime luxuries: coffee, chocolate, cigarettes, soap. At Camp Alva, Oklahoma, designated for Africa Corps personnel, Local churches sang German carols. Boy Scouts delivered handmade cards. Families with sons fighting in Europe sent homemade treats. The Christmas feast. Turkey, ham, vegetables.